You know, any surgery has its risks, and when it comes to gynecologic procedures, one of the most recognized complications is an injury to the urinary tract. So in this explainer, we're going to break down what that really means, why it can happen, and the incredible ways surgeons are trained to handle it.
So, what are we talking about here? Well, the number you'll often hear is that this kind of injury happens in about 1 to 2% of cases. Now, I know that number might sound a little high, but it's really important to put it in context.
And here's the thing, this isn't some random, out-of-the-blue accident. It's a known, recognized, and, most importantly, manageable risk. Surgeons train extensively to avoid it, spot it right away if it happens, and repair it effectively. It's a challenge they're prepared for every single time they operate. All right, so here's our game plan. We'll kick things off with the risk itself, then we'll explore the tricky anatomy of what we're calling a crowded neighborhood. After that, we'll map out the specific danger zones, look at how these injuries are actually found, and wrap up with the amazing art of surgical repair.
Okay, let's dive into our first section, a hidden risk. You know, even with all the incredible advances in surgical tech, this risk still exists. And it's not because of a lack of skill. It's simply because of the incredibly complex layout that surgeons are working with.
Now, this is really interesting. When we say urinary tract injury, it's not all one thing. In fact, as you can see here, injuries to the bladder are actually about 3 times more common than injuries to the ureters. And the ureters, remember, are those 2 little tubes carrying urine from the kidneys down to the bladder.
Now for Section 2, Anatomy, a crowded neighborhood. So why is this a risk in the first place? Well, it pretty much all comes down to one thing. The female pelvis is an incredibly packed and complicated space. All these vital organs are right up against each other.
Just take a look at this illustration. It shows the journey those ureters take. They're these long structures tucked way in the back, behind the main abdominal lining. And look at their path. They have to travel all the way from the kidneys, snake their way right past major blood vessels, and then dive deep into that crowded pelvis, getting super close to all the reproductive organs.
And this brings us to a classic phrase, a little mnemonic you'll hear all the time in medical schools and operating rooms. It sounds simple, but it describes one of the most critical anatomical intersections in all of gynecologic surgery.
So what on earth does it mean? Well, think of it this way. The water is the urine flowing through the ureter, and the bridge is the uterine artery passing right over the top of it. This little saying is a powerful mental shortcut for surgeons to remember this vital crossing point, which is a major hotspot for potential injury during a hysterectomy.
Okay, so we've got the lay of the land. Now let's get out our map and pinpoint the real danger zones. These are the specific anatomical spots where surgeons have to be extra careful. Take a look at this diagram. It shows you exactly where things can get dicey. You can see there's a risk up at the pelvic brim where major blood vessels are often tied off. And there it is, that water under the bridge spot, right where the uterine vessels get divided. There are also risks down closer to the cervix and where the bladder connects to the top of the vagina.
And this table really lays it all out. It lists the most common places a ureter can get injured. We've got our bridge spot, of course, we've got the pelvic brim, and then there's this area called the Tunnel of Wertheim. Sounds kind of dramatic, right? Well, it's this super narrow passage near the cervix that the ureter has to squeeze through right before it plugs into the bladder. Each spot is its own unique surgical challenge.
Okay, so we know where an injury might happen, but how do surgeons actually find out if one has occurred? That brings us to Section 4, which is all about the critical process of detection, both in the heat of the moment and in the days after.
Basically, injuries get spotted in 2 main windows. First, there's intraoperatively. That's a fancy word for during the surgery. A surgeon might just see it happen, or they can inject a special dye that turns the urine blue, making any leaks really obvious. They can also use a tiny camera, called a cystoscope, to peek inside the bladder. Then you have post-operatively, after surgery, where a patient might develop symptoms like a fever, pain in their side, or some unexpected fluid leakage.
And get this, the split is pretty much dead even. It's about 50-50. Half of these injuries are caught right there on the operating table, but the other half aren't diagnosed until days or even weeks later. This really highlights just how important it is to have both incredible vigilance during surgery and super careful monitoring afterward. And that brings us to our final section, and it's a really cool one, the art of surgical repair. Because if an injury does happen, surgeons have an amazing toolkit of sophisticated techniques to fix it. This is where surgical skill really shines.
So the fix really depends on what kind of damage we're looking at. If a ureter just got accidentally tied off with a stitch, the repair can be as simple as just snipping that suture and placing a little temporary tube, called a stent, inside to make sure it heals well. For a partial cut, they can stitch it up directly, and if the tube is cut all the way through, they can either perfectly reconnect the two ends, or, if the injury is low enough, they can actually just plug the ureter into a new spot on the bladder.
And these two images give you a great visual of just how versatile these repairs can be. On the left, you see that precise reconnection of the tube's two ends. But check out the one on the right. This is incredible. If there's a bigger gap to bridge, surgeons can actually free up the bladder and hitch it higher up in the pelvis so it can reach the ureter.
Yeah, that procedure is called a Pose's hitch, and it's basically surgical engineering. Here's how it works. First, the surgeon puts some anchoring stitches into this big, strong muscle deep in the pelvis. Then, they make a cut in the bladder and they literally pull it up and hitch it, like a trailer, to that anchor point. Finally, they connect the ureter to this new, higher bladder position. It's just an incredibly elegant and effective solution.
So no matter which fancy technique they use, it all boils down to a few fundamental rules. The connection has to be completely tension-free. They use these superfine, delicate sutures that dissolve on their own to avoid inflammation. And they almost always place a temporary stent inside the ureter to act like a scaffold, holding it open so it can heal perfectly.
Which kind of brings us to our big final thought. We've gone through a lot of really technical details, but how does knowing all this, understanding the risks, the anatomy, the incredible solutions, how does that actually empower you as a patient when you're facing surgery?
All right, let's wrap this all up. At the end of the day, here are the key takeaways. Urinary tract injury is a known risk, not a surgical failure. The anatomical danger zones are incredibly well understood. Diagnosis can happen both during and after the procedure, and there's a whole toolbox of sophisticated repair techniques. Ultimately, being aware of all this isn't about creating fear, it's about understanding and appreciating the immense level of planning, skill, and care that goes into ensuring patients' safety.